Whether you're returning to work, stepping out for a well-deserved evening, or simply handing off the midnight feed to your partner, pumping becomes an essential part of your breastfeeding journey. And the milk you collect, it's often called liquid gold for good reason. It contains living cells, antibodies, hormones, and perfectly balanced nutrition designed specifically for your baby. Every drop matters. Today, we're covering the practical side of pumping, how to make it comfortable, effective, and safe, along with the storage rules that protect your milk's powerful benefits. Segment 1. The secret to pumping success. Flange fit. If pumping feels painful, or you're collecting very little milk, the issue may not be your supply. It may be your flange size. The flange is the plastic funnel that fits over your nipple during pumping, and size truly matters. Too small, your nipple rubs against the sides of the tunnel. This causes friction, soreness, even blisters. Too large, excess areola gets pulled into the tunnel. This can compress milk ducts and reduce output. Just right, only your nipple moves freely inside the tunnel. There is space around it, without excessive pulling of surrounding tissue. Most pumps come standard with a 24mm flange, but many women actually require a smaller, or sometimes larger, size. Measuring your nipple diameter and adjusting accordingly can dramatically improve comfort and output. When fit is correct, pumping should feel like gentle suction, not pain. Segment 2. The rule of 4 for storage. To keep your milk safe and bacteria-free, remember this simple framework. The rule of 4. 4 hours. Freshly pumped milk can remain at room temperature for up to 4 hours. 4 days. Stored in the back of the refrigerator, the coldest area, milk is safe for up to 4 days. 4 to 6 months. In a standard freezer, milk is best used within 4 months for optimal quality, though it can remain safe for up to 12 months in a deep chest freezer. Always label bags with the date. Store in small portions, 2 to 4 ounces, to reduce waste. And remember, colder and sooner is always better. Segment 3. Thawing and warming safely. There is one absolute rule. Never use a microwave. Microwaves create uneven hot spots that can burn your baby's mouth. They also damage the living immune components in breast milk. Instead, the best method. Thaw frozen milk slowly in the refrigerator overnight. The faster method. Hold the sealed bag or bottle under warm running water. Or place it in a bowl of warm, not boiling, water. After thawing, milk must be used within 24 hours if kept refrigerated. Do not refreeze thawed milk. If your baby doesn't finish a bottle, it may be offered again within 2 hours. After that window, discard any remaining milk. Safety protects your baby's delicate immune system. Segment 4. Busting myths. The pumping volume myth. Myth. The amount I pump is the amount of milk I have. Fact. A pump is not as efficient as your baby. Your baby's mouth, their warmth, their scent, and skin-to-skin contact trigger a far stronger release of oxytocin and prolactin than a plastic machine ever can. If you pump 2 ounces, but your baby is satisfied, producing wet diapers, and gaining weight, you likely do not have a supply issue. Pumping output is not a perfect measurement of production. It is simply a snapshot, influenced by stress, time of day, hydration, and flange fit. Trust the bigger picture, not just the bottle. Whether milk reaches your baby directly from the breast or through a carefully prepared bottle, you are providing protection, nourishment, and love. Pumping takes planning. Storage requires attention. And you are managing all of it. Thank you for being part of this maternal health series. Your commitment matters, and every drop truly counts.